started. Charlotte isn't here yet, but well, hopefully she'll come. And first and foremost, we'd like to thank Dina Young for fixing our lunch, and it was wonderful. And thanking Lima for hosting, and those of you on conference calls, sorry you didn't get the notice because you missed out on lunch, but we waited for you. So we'll call the meeting to order, and we'll start with a roll call around here so we know. Just go around. I'm Tom Rice. I'm the current chair of the Beaverhead County City Board of Health.
Nicole Hazelbaker, the university.
David Olson, Lima Mayor.
Gina Young, clerk, Lima.
On this side of the table here, go ahead.
Cindy on the sec for Terry.
Russ Schwant, City of Dillon.
Mike Clacken, Mayor, City of Dillon.
Sue Hanson, Beaverhead County Public Health Director.
Hey, go ahead, Tracy.
Casey Elliott, newspaper.
Jeremy Crawford, Southwestern Montana News.
George Warner, individual.
Oh, excellent. Megan Evans just joined us.
Okay.
Okay.
And
we
we
have
have
one
one
more.
more.
Allie Turner, I'm an MSU student working with Sue Hanson.
Okay, welcome.
Thank you.
Thanks for letting Sue bring you.
Yes,
She's working with you? Oh,
Yeah.
okay.
thanks for having me.
Okay, we got one more on the call. We've got Megan Evans, Dr. Megan Evans is on the call. Just called in, and go ahead.
I'd like to know, if you read through our bylaws does not allow meeting attendance through the phone or through Zoom or anything. Now, we let that go, I understand, when we had a pandemic. Pandemic's over in Montana.
No, it's not over.
It's over in Montana, there is no pandemic, according to the governor.
The governor's halted it.
Hmm?
That's, okay.
Well, okay, the emergency's over to allow this to happen. So really, from now on, they should be attending the meeting in person, or they don't attend. In my opinion, that's what our rules say.
So who do the only one we have on there is Megan.
I understand.
Okay.
I'm just saying, this is just a general statement, I'm not picking on her,
Okay.
and not saying not to take her input this time.
Okay. We'll bring that up. You know, we can alter. It's today's world. Cell phone, conference calls and Zooms. We live on the commission. We constantly are involved in it, all the time.
I think that's one of the good things the pandemic has done for us. We found other ways to communicate and keep connected.
I was at a meeting here the other day with federal aeronautics and state aeronautics and all, and it was all, I think there was only 4 of us in the room and 8 on the Zoom. I mean, it's just that way, the engineers, everybody's on the Zoom. So, but anyway, it's just a change of times, and you gotta probably put it in the minutes or in the bylaws or something like that, that it's effective as long as the board approves such a move. But it helps get business done, let's put it that way.
Yeah, but it's not allowed by the bylaws.
But we can change those
With a vote.
with a vote, yeah. Which we're going to as far as the county. I mean, we don't have a problem with it. You know, it helps get something done. You aren't delaying the process that way. So, anyway.
I apologize, this is really the only way I can join this meeting with the amount of patients I've scheduled today.
Well, that's fine. I'm glad you're calling in, and again, if as we move down through, if you have a comment, speak up. Any one of you on the phone, even also doctor, go ahead and speak up, and we'll acknowledge your presence and take your comments anyway. Okay?
So is there a process we need to do to change those bylaws?
Yeah, we can go through the
During the
process
meeting.
during them. We have to just go down. So we'll probably have a bylaw review, if you will.
Yeah.
And just go down through top to bottom, and review it, and then put something in there and amend them or something like that.
Yeah, that's good.
Put it on the agenda.
Put it on the agenda and start that process.
All it has to be is on the agenda.
Put it as an agenda item. Make a note,
Amend and revise.
amend and revise. We need to review them first and then go down through and amend and revise. So,
Okay.
okay. Okay, we've established a quorum, I assume?
Yes.
Okay, we will proceed. Number one is public health update, including new legislation regarding Board of Health. And being around the legislature off and on, there was a whole lot of public health bills. A whole lot.
There was.
I want to say 28, if my memory's right.
So I'm hoping you guys will help me with that when I get to that point. I have a little report that was done at the end of legislature, but I think so. Bills have been signed since that and those kind of things. So anyway, I thought it would just be good to kind of go over some statistics. And I don't know if you guys have been on the Montana Public Health site or, okay. It has a lot of great information there. It's the same site that you see the map with the numbers and that kind of thing. It has lots of different reports. They try to keep them as up to date as possible. And so the one that I gave you guys is the interim analysis of COVID-19 cases in Montana. And this is as of July 2nd, and they do update this on a monthly basis. But they're just really nice reports, give you kind of a clear understanding of what's going on or what has happened with COVID. So I just kind of wanted to go down on some of this and just kind of, like I said, give you an idea of what's going on. So anyway, with the first page, you can see it gives the total number of cases in Montana per county.
Sue, can you hang on just a second? Who else joined?
Somebody else just joined the phone? Who just joined the conference call?
Sorry, Tom, that's Jim. I got disconnected for some reason.
Oh, okay.
Oh, okay.
All right.
Thank
Thanks,
you.
Jim. You bet.
So I apologize for those that are on the phone. It's going to be a little bit difficult to follow this, but
Just, yes.
Speak up, yeah.
Speak up.
Or maybe even come over here. I don't know, Sue.
If you speak up, you'll be.
You're kind of quiet.
okay. I'll yell.
Use your mom
Just don't
voice.
throw
Use
stuff,
my mom
okay?
voice. Okay, so the first map shows, like I said, the reported number of cases in Montana as of July 2nd. Beaverhead County's had 928 cases so far. Some of the dark blue ones you can see are the larger counties. Obviously, they're going to have the larger number of cases, but just for instance, Yellowstone County has over 18,000 cases of COVID. So, and then you go to the teeny tiny little counties as far as population goes. Petroleum had 12. So it's kind of interesting to see that. I just wanted to point that out. On the next page, it shows kind of a spike in cases. And you can kind of see that peak right there, starting actually from August to about January, with the biggest peak being between October and November, and we in public health definitely know that one well. I don't think we slept at all. We were at our office constantly. And then that was by illness onset, and then the next little graph is data report to the state. So it pretty much parallels the date of illness, which it should. On the next one, it shows the laboratory data. It shows the total number of tests that were done. As you can see, the Montana State Lab actually didn't do as many as the private laboratories. So we really depended on those private labs to do a lot of our test results for us. And you can see the positive test results on the next one. On page 4, it has the COVID testing in Montana. I thought that was interesting because I did not know how many tests that we have done in Beaverhead County. And as you can see, we've done 11,667 tests in Beaverhead County. Gallatin's done over 18,000. Let's see, Flathead's done over 14,000. Trying to see here, petroleum did 21. So, again, it's all over the place, but we did do quite a bit of testing. Hey, Charlotte.
Sorry, I'm late.
So the population of Beaverhead is what, around 8, 9?
8,909.
You know, you'd see different things. I've seen 9,200, I've seen 9,000.
So that must mean other people came in or people got tested twice?
Oh, yeah, people got tested more than one time,
Okay.
definitely,
There was
yes.
people from other counties came here.
Yeah.
The line's too long on the other ones.
Yeah, that's not exclusive of Beaverhead County residents, just how many tests that were done in Beaverhead County, yes.
How many did you say residential in Beaverhead County?
Beaverhead County, there's anywhere, it depends on the census, but she's right, they're between 9 and 92. Somewhere right in there. But totally depends on where they call home sometimes.
Yeah.
You know, you have these absentee people, but they're called home where they vote and that kind of thing, so they can't be counted here. So it's kind of a 9 and 92.
And it's been that way for 100 years.
So it's, so it's,
Mine was the same way. We have people that live here 3 months of the year, and we have people that live here 6 months of the year, and
yeah.
when and how do you count them? Okay.
And then in the next graph, it just shows testing per 1,000 population. You can see Beaverhead County's kind of right in the middle there with our rate. So I think we did a pretty good job of testing people. On the next one is interesting. It's the congregate setting. And it's number of congregate settings, not people, but settings with COVID cases by type in Montana. And as you can see, school K through 12, there were 594 of those settings that had COVID cases. Then it goes into assisted living facilities, had 139. Long-term care facilities had 70. University, there was 23. Correctional facilities, 18. Group homes, 14. Healthcare facilities, 10. Senior independent living, 8. And mental health facilities, 3. So again, those are the settings. On the next graph, you can see the number of cases in those settings. So in school K through 12, there were a little over 8,700 cases. University, there were almost 4,000 cases. Long-term care facility, little over 3,400. Assisted living, little over 2,400. Correctional facilities, 289. Group homes, 96. Mental health, 46. Healthcare settings, 42. And senior independent livings, 27. So I don't know if that surprises anybody. I actually thought there would be, well, no, there's not that many universities in Montana, so I was thinking the settings would be more, but that's probably about right. But they certainly were, kept us busy. Let's put it that way.
So Western would be counted as one
Yes.
setting,
One setting.
and then Bozeman would be one, Missoula would be one.
Correct.
That's why there's 23,
Yeah.
although you see 4,000.
Yeah. And then on page 6 is the age distribution. And I don't know if anybody was surprised about that, but the biggest age group that had COVID was the 20 to 29-year-olds. There was over 21,000 people. And then the 30 to 39-year-olds, there was 18,571. And then it looks like the next one is 40 to 49 with over 15,000. And then it kind of goes down from there. So, and that is I'm not surprised because that is the age group we're still trying to vaccinate. So it's kind of interesting. And then it has the race too, but I didn't think we needed to go through that. On page 7 is the outcome of COVID-19 cases by age group. And let's see, total reported cases versus recovered and released from isolation and deceased. this was a little hard to follow, I thought, but it looks like, yeah, like there was 2 deaths in people 20 to 29-year-olds. There were 23 deaths in the 30 to 39-year-olds, 41 deaths in the 40 to 49-year-olds, and then it just goes up from there. So, and that's not surprising, we expected that. As far as pre-existing conditions, again, the pre-existing and underlying conditions was available for about 76% of the hospitalized patients. With that data that's available, 74 indicated they had at least one pre-existing condition. And can you guess what the 2 is? Well, you can see it on there. Hypertension and diabetes were the most common pre-existing conditions. And it's the same thing with the deaths that they had with the pre-existing conditions. Hypertension was listed for 37% of the deceased patients, and diabetes was 24%. So, anyway, there was a study done. It was provisional data that the state of Montana did from March 26th to October 31st of 2020. So this is a while ago. And at that time, they said COVID-19 was at least the 4th leading cause of death in Montana at that time. Obviously, we're still doing data analysis, and that's probably an underestimate. It's probably higher than that. So that was kind of interesting as well. Is there any questions about that?
So are you saying that, how do I want to say this? Because of the 2 illnesses, the pre-existing and the COVID, is that counted as a death by COVID?
So how they count a COVID death is if it's in it can be in 2 places on the death certificate. It can be the cause of death, and then it can be the contributing cause to death. And so let's say they, I don't know, died of a heart attack, but they had COVID that made them sick, or died of pneumonia. That's the biggest one, pneumonia.
Yeah, that's what I was trying to bring out.
But it was caused by COVID, yeah. So anyway, yeah, those are the 2 things. So that's what they're looking, and they're still reviewing death certificates on that. And the thing with death certificates, there's really no standard way to write on that. So, you know, the docs, well, you put 5 docs together and they probably would fill that death certificate out a little bit differently. So I wish there was some standardization with that, but Megan can probably elaborate a little bit more on that. There's probably more to it than that. And also the county coroner can document on that as well. So, I don't know. Do you have anything to add, Megan?
Yeah, I mean, I think it is sometimes hard to sort out as far as, you know, what's cause of death, but like you said, a lot of people can have an underlying condition, but that's just chronic, and then they have COVID, and that's the primary cause of death. And then we did see some certificates where it was just a contributing cause of death, but not the primary cause. So I agree. I think even as a physician, I think people could benefit from more training in filling those out adequately, just because we're rely on them so much. I bet you will see an overhaul of that process, because in the past, I think most of it's been looking at accidents and tobacco as causes. Those are clearly on there, but I think we'll probably see a change in that process just to get better statistics capturing capabilities. But I still think it's pretty accurately able to address who has died from COVID or not. It's probably an undercount.
I agree.
Still.
That's what I was trying to get out, was that, you know, I mean, the people were saying, well, this is a big deal, and then they're trying to make it a bigger deal, and they were put, anybody that died, they they died from COVID, you know, and all that. And there was a lot of that going on in this community at that time, and I'm sure there was statewide too, but that's kind of what I was trying to get at. Thank you.
The next report that they send out is, and they do it for each county, and you guys don't have this. But they do Montana vaccine update for eligible Montanans by age group. And they must do this once a month too, because the most recent one is 6/18. So it says, actually, I think I'm lying. I think there's one from July 2nd, but I didn't grab that one. Anyway, it shows the age group who are vaccinated and the percentage of vaccinated, and that means they have at least one dose, and how many are remaining. So like in the state of Montana, this one says there's 51% vaccinated and 49% remaining. The age group, 12 to 17, 22% have been vaccinated. And then it just goes 18 to 29, 36%'s been vaccinated, and 30 to 39, 44%'s been vaccinated, and it just goes up. On the next page, I have Beaverhead County. And for our 12 to 17-year-olds, 16% has been vaccinated. We got a long ways to go with that. 18 to 29-year-olds, 24% vaccinated. And then the 30 to 39-year-olds, 43% vaccinated. So those first two groups really are the ones we really need to focus on. And with saying that, I would like to throw it out to ideas of how public health can get to these groups. What do you see that we're lacking in, focusing on these groups? Do you guys have any ideas, or?
Do you have a total number of percentage of Beaverhead County?
Yeah, 50% vaccinated.
Thank you,
with
sir.
one dose.
Thank you.
Yeah.
How many of the elderly, let's call elderly 70 or higher?
Percentage?
Yeah.
I mean, vaccinated?
Yeah.
70 to 79 or 77% vaccinated, and 80 and over, 90%.
Okay, so the high-risk groups are covered fairly well. Not perfect, but
Pretty good.
Probably
Yeah.
about all you're
You're
gonna
gonna
get.
get, that's all you're gonna get.
Yeah, there's people that's
They-
definitely not gonna get it.
Ain't no way.
You can talk to them and try to convince them, but there's people that say, I'm gonna die, I ain't gonna get no damn vaccination to help kill me. You know?
That's exactly.
That's true. I think there's
That's right.
kind of two groups right now. There's that group that says no way, and then there's that other group that's a little hesitant, and maybe when the vaccine gets approved, that they'll go ahead. I think there is a small percentage of those people, yeah, they're gonna wait on that. Yeah, we do our vaccines, public health does anyway, every Wednesday. And we see maybe 16 people a day, so it's gonna be hard to get up to a higher percentage point. I think we've been at 48 fully vaccinated, 48%. We've been there for a long time. So, and I know, Safeway is a little frustrated too. They're not getting very many. And again, the whole issue is, well, I guess it's not an issue anyway. Now, they're saying just vaccinate regardless of wasted dosages. But as a public health person, to open up a vial and give one dose and throw away, 10 other doses or 9 other doses, it's just not right.
No.
It's just not right. And then you have these countries who can't even get vaccine.
Right.
So we try to work with the CHC, like they have a list, and if we can try to get people in that way, or if we have one person for the Moderna, we'll maybe try to work with Safeway, but the state's saying just give it, and it's really, really hard to do that. It's not a flu vaccine, like, you can open a multi-dose vial of flu vaccine, take one dose, stick it back in the refrigerator, and, you know, you don't worry about it. But these are totally different kinds of vaccine. But we do have all 3 vaccines. We have the Johnson & Johnson, which is the 1 dose, and we have the Moderna and the Pfizer. We're getting the Pfizer from B.O.H. They have relaxed some of the storage requirements with the Pfizer, so we're able to just go and say, I only want, 5 vials of it, and I can bring it back, and it's good in the refrigerator for, I believe, a month or something like that. So it makes it much easier for us to get that. And it seems like now that we have that available, more people want the Pfizer than they do the Moderna.
That's 1 shot, isn't it? Pfizer?
No,
2
it's
shots
2.
Pfizer?
Well, but
No,
it's,
Johnson & Johnson's 1
yeah, so it's the second dose for Pfizer is, 3 weeks, where the second dose for Moderna is 4 weeks. So you can get done a little bit quicker. So anyway, we're still working on that. Trying to look at some venues to where we could possibly set up. I just don't know if that's going to make a big difference. I don't know. The state's really pushing us to go out to, businesses and that kind of thing. We did call some businesses, and they were interested in doing that. It's not like Dillon's that big. I mean, there's, like I said, you can go Safeway or Public Health or whatever. So anyway, I'm just looking for ideas on that. I know, obviously, the unvaccinated group are the ones we're going to really start seeing with COVID vaccine or COVID cases. And those are going to be the younger people. And when school starts, I wish I could be more optimistic, but I do feel like we're going to have a little surge. Again, with the college starting and the schools starting. There is, other than protecting you and reducing the risk of COVID-19, for those kids, also, you don't have to, once you're fully vaccinated, you don't have to quarantine if you are a close contact. So that's helpful for those sports kids who are in sports. They can still go and do their activities. It could also help with spectators coming to games, because they would not have to, again, quarantine. So there are some other advantages to that, other than the obvious advantage. So, I don't know, we're still working on it, and hopefully we can get some more of the younger people vaccinated.
So,
yes,
we do have plans at the university. We met with Dr. Evans earlier this week. We'll be doing vaccination clinics for our athletes as they come in.
Great.
Part of it will be, I think they're going to do it, the first vaccination on the 13th during their physicals for the new athletic students, or student athletes.
Mm-hmm.
And then we will also do a clinic after school has started.
Okay.
We haven't yet set that date yet.
Okay.
To help with that age group. And we know with our athletes, the Frontier Conference has not decided for sure yet, but they may have to be tested if they're not fully vaccinated for every single game they participate in.
last year.
So if they're not, that might be a motivation for some of them to get their vaccination if they can. But we're hoping the Frontier Conference doesn't do that.
I know.
But we have a couple of colleges over in Oregon that they're pushing that, because the state of Oregon may be having that still a part of their protocols.
Nicole, you say you're going to have vaccination clinics for student athletes. Are you going to try to do vaccination clinics just in the first few days students are on campus, just try to?
Not the first few days, we're doing it a couple of weeks in.
Well, I mean, for the general populace of the campus.
Yeah, that's what the clinic's a few weeks in. August 13th will be for our athletes that will be coming in, because they'll be here for starting practice for the fall sports. And then we'd like to time it that they can get their second shot at the time that we do the clinic for the general students, a couple weeks into the semester. Or we may wait and do it the Wednesday after block 1. Because the concern is
The last day of the
age group-
block or the
Mhm.
week later? Yeah.
No, the last day of block 1. The concern is that age group does get sick. And we don't want them to miss a day of class because they just received their COVID shot, so.
So I would suggest the J&J, not do,
Well, we talked with Dr. Evans about that, and the J&J, not for the females, but for the males,
oh, okay.
because of some of the, yeah.
I see.
Now, why would we even think about doing vaccinations for the kids, for the 12? I look on the sheets, and all the age groups down there between the 0 to whatever, 0 to 10, 10 to 19, there's been 0 deaths in Montana. That's about 20,000 kids tested positive, but then if you go 20 to 29, also that's about 40,000 cases.
Yeah, but if you vaccinate them, they won't transfer it to unvaccinated.
But there's science out there showing they don't transmit to the other people as much.
That's, now, I've read something, I have something that says totally different, that they have a higher viral load and they can, even asymptomatic, they can transmit easier.
Well, all the
Especially, I
science that I've
imagine,
seen,
these new variants.
Yes.
all the science I've seen does not show that. And the new variants even, it's not like that. Plus, right now, the thing that's not even been talked about is there's quite a few deaths that are coming out from the vaccines. Right now, the CDC publishes over 10,000 people in the United States have died from the vaccine. Kids really are being high risk of death and of being hospitalized for weeks. It hammers their hearts. Plus, if they've went through and fought off the virus, that actually increases your risk of dying or going to hospitals by getting vaccines.
I would like to see that data, Mike, because that has not ever been reported to.
Well, that's because the politicians are reporting the data, not the science. The science is quite a bit out there on that subject. It really is.
I would have to say that the scientists are showing that there's an incredibly rare risk of myocarditis in the younger kids. A handful, I think it's less than 20 cases were even hospitalized, and it still is not directly linked to the vaccine.
Yes.
In the United States or
Correlation is
Montana?
not a direct causation.
In the United
US?
States, yeah.
Well, then I've met every one of them then, you know, or I know relatives of them, so it's way higher than 20. I can tell you that right now.
Well, I think we have to go back to,
No,
we
that's
need to
numbers from the CDC report from Bayer.
Right, not the science report, but the politicians' report.
Well,
There's a difference, there really is a difference.
I think we go back to,
Bayer's is politically based.
we offer the vaccination, and each person individually needs to make the decision.
It's their
If
choice.
it's their choice or
You're
not.
not doing that for the college, you're demanding they be vaccinated.
No, we are not.
Okay,
There
it's
is
just a
no
clinic.
demand.
She never,
Okay.
she never said that.
No.
Okay.
Not at all.
Well, that's okay. There's quite a few universities that are going that way, that you
State
have
of
to be.
Montana is not allowed.
Yep, it's not.
I do want to go back to the children. Actually, you know, people kind of poo-poo the COVID with the kids, oh, they're not that sick, that, you know. But if you compare it with influenza deaths, which we all worry about, try to get our kids vaccinated with that. And I'll just read this. From 1999 to 2019, influenza was the 8th leading cause of death in children. Yet this season, there was 1 pediatric flu death. Obviously, we know why. It's all the mitigation we did with the masks and the social distancing and that kind of thing. If that isn't, something that proves that those worked, there it is right there. We didn't even have any flu cases in Beaverhead County. I don't think we had any flu cases in Montana. Anyway, Yet in the same 2020-2021 season, the American Academy of Pediatric reports 327 deaths in children in the United States. And the CDC reported 452 deaths. And so it's probably however they determine what a death is, or criteria. Anyway, they say that they're both underestimates, as of course the data is not complete yet. COVID-19 in approximately 1 year killed twice as many children as influenza does most years, despite painstaking efforts to prevent infection. This easily makes COVID-19 a leading cause of death in children. So it is a big deal. It's not a lot, but it's more than a lot of other vaccine preventable diseases that we see. So it does need to be taken seriously. So I'll just leave it at that.
Okay. Do we move on
I
to,
think one statistic I'd like to add as far as vaccines go that the state shared with us a few weeks ago was that in the last 3 months, 96% of hospitalizations in our state have been in the unvaccinated. So I thought that was a pretty powerful number.
Yes. Yeah.
with that said, Sue, you got here new legislation regarding Board of Health. Do you want to touch on that?
Well, like I said, I'm definitely not the expert on this, so I'm hoping to get some help from people. Let's see. So there's House Bill 121, and it requires elected official approval of local health board and health officer actions. This was signed by the governor and does several things. Changes to definitions of isolation and quarantine, I don't know what that is. Definition of governing body includes an option for the entity, I'm not sure what that means. Board of Health can propose regulations and fees for adoption by the local governing body. Board of Health recommends to governing body appointment of health officer. Orders issued by Board of Health and health officer in response to emergency disaster declaration remains in effect until the majority of governing body moves to change it. Local boards of health may adopt rules necessary to implement and enforce regulations as adopted by the local governing body. Health officer emergency rule cannot interfere with attendance at church. It changes the penalties for violation from criminal misdemeanor to civil penalty. So I don't know if you, Mike and Tom, can elaborate on governing bodies, what that means.
I'd have to read the bill complete, but you know, the governing body inevitably points at us, or Mike.
Let's say, is it both of you, since it's a city, county?
All three.
All three.
And that's where a decision's gotta be made by all three on how is it, what weight it goes on
It'd
the
be
votes.
Lima, Dillon, and us.
I gotcha.
Correct,
And you
but
couldn't-
how does that,
You couldn't
How's that
just-
work?
but how does that work? Is it one vote for each body?
I have no idea.
We don't either, we gotta come to an agreement.
We gotta figure that out, because it's in effect as of, I don't know
But
when,
that-
July
A
1st?
lot of that,
You know what, they're still arguing about it now.
I understand, they probably are.
there's still interim committees that are
It's,
arguing about it.
so much of this has not even been, I mean, this has been the biggest mess that I've
It
ever
is.
seen.
There was 28 bills, Board of Health bills up there,
Yeah,
just
yeah, it's just,
all over the board.
Now, this says that, I'm gonna paraphrase, that
Oh, you got
the
the,
local governments, yeah, I got all, not all of them, but quite a few, I
okay.
got the 121.
Okay.
Right now, we are formed by interlocal agreements, so it's those governing bodies of the interlocal agreements, which is the three of us. Okay, and those are the ones that actually declare the emergencies, those are the ones that actually control. So this board can't do anything without their permission. All three of them have to vote to do it.
That's right.
So anything, they can't just restrict any, you know, this committee or board, whatever, cannot restrict anything without the governing body's agreement, the three of them.
And I
Also, the governing bodies, they appoint, or this body appoints or recommends to the bodies, the three for the health doctor.
Yes.
Also, any orders coming from them, unless it's related to the standard, like you go down and you see, trying to remember, whatever, venereal diseases or whatever else, they can still go in and control that without governing bodies, and. But things with like pandemics, you've got for sure, any of the requirements coming down, comes down and says that you've got to have a governing bodies agreement, the three, however the three vote, okay. Also, you can't, like you were saying in there, restrict, the penalties is not made jail time anymore. The police cannot lose their jobs for not doing what the board says to do. That's been removed. Still the power totally relies upon the governor and the mayors
Is it a
to set orders.
Yeah, is it in our case, is it a 2-to-1 vote carries, or is it?
We don't know, that's what we gotta negotiate and work
Yeah,
on.
they didn't say nothing about that.
I heard
It
that
could
was a
be,
huge discussion in Helena, whether it was 2-to-1 or it had to be unanimous.
I don't think they've ever made a decision on it.
we don't know.
No.
And like even for ours, the county has 3, City of Dillon has 2, Lima has 1. Does it go by Lima has 1 position or 1, and City of Dillon has 2, and the county has 3? I don't know. Those are things that we're gonna have to work out, and probably sooner is the better.
Yeah, and Helen will help us work that out.
Well,
It'll have to be a statewide decision.
Well, yeah, I would think it couldn't
It
go
would-
by county.
No, it's
County
a
by county.
statewide thing, because what do I want to say, interim committee of public health, is that what it is? Or interim committee of health and welfare, or some little branch of DPHHS, which is the largest employer in the state.
Think about it, yeah, they can't seem to come up with a list of suggestions that everybody's agreeable to. I mean, it just kind of put us out here on our own, and we can sit here, Mike and Tom and I could sit here and argue about it all day long. I don't know, it's just been a mess since it started, in my opinion.
And if we step forward wrong and it defies the state, then all of a sudden we have no teeth.
Right.
Yeah.
So it really has to be settled, and then it becomes law, the
Yeah.
MCA code, whatever. And you just go about it that way. So it doesn't surprise me, not at all.
Well,
George,
just so
go
you
ahead.
know, that's, coming, and that will definitely affect the Board of Health, because we
There'll be
have to
some.
change our bylaws and probably
Yeah, we got
everything.
district meetings in regards to Mako and that, and this subject came up and everything. The same, we didn't talk long and ended up wait and see what the interim committees start doing. And they're all getting formed and starting to have those, and those things like this we send things that will reflect back to those meetings. That truly, it's gotta be a statewide thing, so
Yeah.
that people are paired up, because there's towns, if you will, that are right on the edge of the next county line. So you gotta be set up that way too. So George, go ahead.
Yeah, you're basically making a little bit of my point. It can't be mutually exclusive unless it was unanimous, because there could be things that would affect Dillon and the county or part of the county that wouldn't affect Lima at all.
That's very true.
And that's why the chief executives, the 2 mayors, have individual authorities. The county's in kind of a harder position because it requires some participation by at least one of the mayors to go forward on some of this.
That's why I asked if it was a 2-to-1 or unanimous, or, and that same thing, comments come up in the district meetings. You know, you take some of the Gallatin, for instance, shoot, there's 3 Forks in Manhattan and Belgrade and Big Sky and all them other,
Yeah.
you know,
Huge.
city, you know, about Butte and Lewistown are totally to city county government,
Yeah.
and that's a little different thing. They're all blended together in a way, but then again, ask them and they're not. I've sat through a few of those meetings.
It's all about the money.
You know, so it's or about my road, not your road.
It's also, we can't, throughout this, we also can't do some certain things that's been done, like you cannot compel a private business to deny a customer of the private business access to the premises or access to goods and services. You also cannot deny a customer of a private business the ability to access goods and services provided by a private business, which means, in my opinion, we don't get to make rules saying that business has to do a certain thing, or you have to, you know, follow some criteria and you'll be not allowed in. That's not, unless,
Not gonna happen, yeah.
The health, so that was on House Bill 257, you were just
yeah,
saying.
257.
But the public health officers can enforce regulations should they be adopted.
Correct, that is correct,
So
yes.
Should be
the
adopted.
person could do that. And then there's Senate Bill 108. Says the Board of Health would need approval of majority, this one says the majority of governing body to accept funds, adopt fees, regulations, use isolation and quarantine measures, reduce public health nuisances, ensure removal of filth, issue written orders for compliance, bring and pursue actions, and issue order. The health officer would have needed approval of the local governing body to issue written orders for compliance, limiting contact between people to protect public health from imminent threats, or bringing violations to the county attorney for prosecution. Lastly, a health officer could have initiated action to recover expenses only with approval of majority of local governing body. This was amended for a citizen initiative to amend or repeal local health board actions. I have no idea what that means.
Means the public can get together and vote and throw out everything.
Yeah, bring it back up again.
Yeah.
And they said this bill's expected to be signed in law. I don't know if you have that one, Mike.
No, I don't.
Yeah. So, hey, this is gonna be so complicated.
Well, it's all over the board, but I'm sure that interim committee will be busy.
Yeah. So I don't know what exactly, how that will work. Okay, House Bill 159. This bill will require the governor's office to provide a plan to the Legislative Finance Committee for the expenditure of certain emergency funds provided to the state from the federal government.
Emergency funds, this one here?
Well, that's, what they're trying to do there is control. The governor was doing a lot of changes. A lot of these that I didn't bring isn't really related to us as much as the governor. Like, the governor can't go and say, because of a pandemic, we're gonna change the voting laws. Yeah, no, that's not
Right.
allowed anymore. You can't do a lot. You can't just go out and spend money without the approval of the legislature. That has to be done within 30 days of when the governor issues it, then it goes to the legislature to run the show, not the governor. So those things, I didn't bring those because really it's not related to us directly. It's more the relating, it's to control the power of the governor.
Yeah, it's an administrative thing.
Yeah.
I didn't see that one, I guess I missed it.
Well, there's a, I don't
There's a
know.
lot.
There's so many.
There was 2,000, little 2,000 some bills. And how. Total? Total. Well, he's trying to sit there, you know, as a representative or a senator, whether and absorb that many. And then try to cull them out and then reauthor them and all that kind of, that is just like that.
Yeah, quite a few kind of died in committee.
Well, you just,
Yeah.
They did, really.
it's incredible just to go over them.
Oh, yeah. Well, the Montana League of Cities and Towns is, you know, if they're going through the same hassle that we are, that the county is, it's just a wreck. And there's no better explanation. And we can sit here and talk about it all day, and when we walk out of here, we won't know any more than we did before.
There's just so much paper.
Yeah, I hate to be that way, but that's the way it is.
And you get, I don't know, you know, like Welch and Wellborn and that, I've been to their, you know, been there and then over to the apartment or whatever, or wherever they're living. And they got 2 or 3 recliner chairs and piles of paper, and little floor lamps and everything else, and they go home and they sit there and read till midnight and trying to sort that stuff out and get ready for the next day. You know, oh, after a while, your eyes, you just, like that.
Hey, Mike, how many bills did you get contacts from over in Helena, from some committee that have you testify on that, for that specific bill during this last legislation? Zero?
Really,
From the legislature.
really.
Not from the legislature, from people that was addressing.
Oh, I've had a few of them.
Yeah,
I thought you
from
meant the
people that was addressing and
legislature.
trying to get these bills through.
No, I've had a
I
quite
could
a few.
have testified every day. And
Yeah,
I finally just said,
Could've just moved
No
up
more.
there and,
yeah, I just,
Yeah, you're right, Dave. I mean, they're all, you know, the MACO has all the committees that go together with all facets of the economy and the land use and the whole business, you know. And I'm chairman of the ag and the water and all that thing, because that's was my world before here. But so you get anything relative to that, then they call in the forces to testify on certain behalves. My older senior people in my life, my father and my father-in-law and those used to say water rights is just like trying to understand your wife's relatives. Which usually started a conversation in my house. Or ended one.
So there's a couple of other bills on the vaccines. You as the Board of Health should be aware, it definitely affects us. This one revises requirements for medical exemption immunization forms and establishes limitations on examinations and uses of immunization records. So that does affect us because we do assessments on immunization records for the schools. We have parents sign a consent to do that, but I know the state immunization program still trying to sort this one out too, exactly what does that mean we can and cannot do. And also who can sign the medical exemptions. It used to be very specific on who can sign it. Now they've opened it up to like nurse practitioners and PAs and things like that who can sign it, which is fine. And then there's House Bill 702, which prohibits discrimination based on vaccine status or possessing immunity passports.
you can't
So,
require
Can't
any of
require
that.
it.
Or nor can you restrict anybody that, or discriminate against if you have it or you don't have it, kind of thing.
However,
But
there's,
you can't ask for it.
yeah, there's specific things like what's in statute, like required immunizations for school and things
School
like
and
that.
such,
Yeah,
yeah.
there's some,
There's
yeah. But again, it just gets so
very,
messy and complicated to try to figure this all out.
But that does come up with an issue because the federal government now is talking about the door-to-door. And our state law now is saying that you can't mandate, you can't collect data on that. HIPAA, I think, does come into effect on some of that. So Montana's in a different position than some of the other states as to whether the federal government is going to send out people on the door-to-door like they suggested this last week. So we need to keep that in mind because that specifically prohibits a lot of that. So
I also like to know, how does public health get access to all the records? Because I know several people, myself haven't, maybe I are known around the county. But there's a few people that I know that said they've been called by public health saying you haven't been vaccinated. How do you know those things? Because that is a HIPAA, only my doctor has the right to know those things by HIPAA. How does public health get it?
We don't call people to tell them that. The hospital that has a list of their own patients and they have called them.
hospitals
The
call.
public health only calls if we know that they had a vaccine and they didn't show up. And so we'll call them and ask them, or if they're due for a second vaccine.
Because these people told me the statement, they didn't write down the name, but it was a lady and they recognized that it was from public health. And you haven't been vaccinated. One of them actually called the hospital and they said, oh yeah, we have an agreement with public health that we can give you all of the records for vaccinations to public health. It's like, yeah, I
Well,
don't
we
know how they got that.
have, so, the way it works in Montana, there's a state immunization registry. So when somebody gets vaccinated in Montana, they have to sign a consent to be put into the state registry. So that gets put in. That means that, say, I move to Glendive or whatever, I don't have my immunization records for me, my provider or my public health person or whatever can look on the registry and see what vaccines I need. So I came in and I said, I think I need hepatitis B or whatever. They can look on there and assess that and say, yeah, this is the shots you need, that kind of thing. So yeah, there is access to that, but they have to sign a consent to be put on that.
But do they get the vaccine if they don't sign the consent?
Yes, they can still get the vaccine, they just don't get put in the registry.
Okay.
Or I'm not sure, or they get put in the registry, but there's like a big thing that says have not consented or something like that, so you can't do anything with it.
Okay.
Yeah. So that's the way that works. I know not exactly what you're talking about now with that, and that was not us that called.
Okay.
That was the hospital.
Okay. Even though they
Yeah.
said it was public
Yeah.
health. That's not right.
Yeah.
Person that, Carol on the phone, that wasn't right.
Okay. Next, Sue, I guess, we've got down here discussion and action and then the JC activities. That, JM and Jason, there was a hiccup.
It was a hiccup.
It was a hiccup as far as Cindy was doing, drafting up the agenda and labeled that. The activities coming, it should be just activities. Skip, J, you're one of many that has activities in the communities, so, but, you know, you aren't selected, you know, pinpointed or however you want to word it. But anyway, there's some discussion and action as far as activities with all of the things being lifted, if you will, restrictions and all that kind of thing. I really don't know what, you know, the board can comment on it. Just, how would you say it, wash your hands and brush your teeth and use common sense and all that kind of thing, and we'll all get through it again, I guess, if we have to, you know. So, but go ahead, I'm speaking on, I'm a power of one up here. Anybody want to add something to that? Discussion and action, you know, and as far as action, activities, future activities, is there anything that we should speak to of the board first here?
Sure.
I think all we can do is do a recommendation like what last year, but I don't think we can tell them now they can't have so many seats. I think they can fill them. You know, from what the laws have all been said, it's in effect now. But I mean, we can give them a recommendation, but they don't have to follow it.
Yeah.
If they don't want. Plus, the other thing, there was a law that was just put into effect, I forgot to tell you guys, that took away any responsibility or any reliability, not reliability. Liability, that's liability from businesses and that if somebody goes into a store or anywhere and they catch COVID and they can prove that they got it from that place, they're not liable.
The business
Unless-
is not liable.
The business.
The business is not liable for many suits.
Or the entity holding the social event isn't liable.
Correct.
It's totally a personal thing.
Unless they were told by an order that you have to do it and they still didn't do it, then they could be held liable to that.
I would like to make a public health comment though on that. People are still calling me, which I appreciate that, but I tell them, you know, just common sense sort of things. If you're not vaccinated, wear a mask, do your social distancing, just try to reduce your risk as much as you can. If you're fully vaccinated, again, please wash your hands. The vaccine is not 100%. So, you know, wash your hands. If you're not comfortable, still wear a mask if you want, you know. So just kind of putting those ideas back in there, it's okay. It's okay to continue to do those things. And, you know, as we get these big crowds coming in, again, it always increases the chance of of having a little outbreak with COVID, especially with the variant. And I did want to talk about the variants. We do have 4 different variants in Beaverhead County now. So it is here. The Delta, as you can probably heard on the news, is almost in every state now and becoming more of the top variant that we're seeing that's causing disease. It's going after the unvaccinated, which again is the younger people. It seems to be causing a little bit more severe disease and hospitalization. So just kind of being aware of that. The pandemic isn't over. That's what I want to tell Mike. Pandemic isn't over. The governor might have said the emergency is over. The pandemic is still here. We still have COVID. And some places are having rising cases, so.
Yeah. And since they labeled it, you know, I don't know if they'll ever not have COVID.
Oh, COVID will be here just like any other thing. We'll just
I mean, it's just
have
that
vaccine
it was
and,
just discovered and it's got a name.
Yep.
Yeah.
So the current vaccines are giving protection for the variants?
yes, so far
Correct.
they seem
Okay.
to be doing it.
There's some protection there
Yep.
too.
And not 100% they're doing it.
There,
Yep. Like again, there's no vaccine that's 100%. So there is going to be breakthrough. But those, like we say with flu, I tell people every time, this isn't going to protect you 100%. You could still get the flu, but if you get the flu, it's not going to be, it's more likely going to be a milder disease. So
Milder
you're not,
case.
yeah, so you won't be as sick. Same thing with COVID.
yeah. With that said, JM or Jason, do you have any comments? I thank you for calling in, showing interest in being in the conversation. Do you have any comments?
Yeah, of course. Yeah, well, this is JM here. I mean, I just would want to reiterate any comments that we made during the last time we joined you guys up at the university. Is, you know, JC is definitely, you know, we definitely want to host our events and try and get back to you as normal as possible, but we definitely understand that, as Sue just said, I believe it was Sue speaking, by the way, you know, the pandemic's still here, so we definitely, you know, just want to be safety conscious and do everything we can as a host organization to make sure everybody is safe and can also, you know, enjoy our activities. So that's why we're here and want to participate today.
Thank you.
I just like to say, I think that's really awesome of the JCs.
Yeah.
That they have so much interest
Yeah.
and they do care and they are promoting their activities as a safe place. They are putting in some protocols that they have learned through the years, and they are keeping Beaverhead County vibrant with the activities that they're bringing, and I think that's really awesome. So thank you, JCs.
Thanks, Nicole.
Yeah, thanks. Anything else, George?
Yeah, I just wanted to speak to the fact that the traditional advice and concerns of this board should never be diminished. Part of, when we got this together, and you were even in a functioning body before I was mayor, Sue, and we dealt with, one of the first events we dealt with though was the rainbows. And you know, it was something none of us had ever seen before, very similar to this. It didn't have the long-term effects that this has had. It had short-term effects. But one thing I don't want to lose is the facts concerning masks and some of the protocols. Sue and I could argue about those for hours. But it's not the intent that I want to hurt her or diminish this body. It's the fact that if we don't say it and get it circulating, we're limited on our thought processes. And these people are becoming involved, and that's a good thing. They're coming, seeking advice. And even if we don't have any, there could be suggestions. And that's the purpose of this body entirely. If you strip away all the authority, it really doesn't matter. It serves a good purpose. And sometimes it's just throwing out bombshells, like I am prone to do, just to get reasonable thought going. And if that helps, then our society's better for it. So that's all I have.
Okay, thanks, George. Great talk. JC's were on, Dave, while you were out, and they had comments praising us, what they're doing. They're gonna keep all their functions going and try their best to.
Keep them safe.
Yeah, they're
They're good.
a good outfit. They're
Yeah, they are.
without a doubt a good outfit. Anyway, any more discussions as far as activities? Have we got a public comment where anybody, you have any comments?
No,
And thanks for coming again.
thank you for having me.
Yeah. Okay, I'll move on here. Old business, is there any old business? It's a topic of discussion. Okay, hearing none, we've got approval of the March 10th minutes. Anybody had taken time to look them over? They were shot to you on an email. With that said, if you've had a chance to look, I'd call for a
Move to
motion.
approve.
I got a first and a second from Sue.
No, I can't, but I have a comment.
Okay, go ahead.
I second it.
Okay, just say, go ahead,
Now
Sue.
discussion, right, okay. I just saw in there, you just spelled the word wrong.
Buses.
What?
Buses. I got buses.
Oh, no, Moderna. You spelled it M-E or something like that. M-A-D, it's Moderna, M-O. Moderna. Vaccine.
So what's the correct spelling?
M-O.
B-E-R-N-A, huh? Okay, and what did you say, Gus?
The word buses.
Oh, I hate that word.
B-U-S-S-E-S.
Doesn't seem right.
I know, right?
Okay, with that said, is there any other corrections or changes?
Was
All in
that the one
favor?
at the university, sorry?
Go ahead.
Was that the one at the university? I know I wasn't there. And I think sometimes it says Western Montana College. It should say University of Montana.
This is UM Western Campus.
It says UM Western Campus on here.
I know on one of our minutes, I don't remember if it's the last one or this one, but it says Western Montana College throughout the document.
Here it says UM Western Campus at the heading. I don't know.
It says University of Western Montana on the end. Next meeting, it says.
Okay. In other words, watch in the future for UMW. Okay, with that, okay, got a motion to approve with additions and corrections, is that correct? Yep. All in favor, say aye.
Aye.
Aye, pull same sign, motion passed. Okay, we got public discussion, comments on subjects under Board of Health jurisdiction, not on the agenda. Could make a decision anyway, but we'll take your comment. George, I didn't mean that like a...
No, that's fine. We need to keep it low-key. Sometimes we're into processes that require low-key. I'm bringing up the issue of my appeal again. It's been almost a year. We haven't been in continuous contact over that period of time. But quite frankly, most of it is irrelevant now. And the reason for that is the new laws have clarified probably 90% of my appeal as being correct. So we can either go through the process of the appeal meeting or hearing, or we can eliminate a lot of that by stipulation. Now, I'm not expecting you guys to do it today, and you're probably going to have your legal advisor there to review that. But I've looked at it recently, and most of it's gone except for the financials. And I'm going to bring up the financials today. When it comes to the financing of the health department through this board, you are responsible for budgeting that activity, both the income and the expenditures. I don't believe that's been occurring. Matter of fact, the bylaws no longer show the necessity. That's in
What's your phone? But everybody...
I think everybody hung
I
up.
think everybody...
Elevator music.
I'll wait
There's your
until
music,
it's done.
elevator music if you
There
want
you
it.
go.
You got the power, George.
I chased them all out of here. So there is conflict between the bylaws and the contract that both Dave and I signed some 20 years ago. So I would like to see the information on that. Again, I stipulate, I am not intending on sinking this ship. My intent is to abide by the original agreement and make sure that it runs smoothly. Now, the reason I was concerned when I initially put this out, because I didn't have foresight that the legislature was going to take my positions on the other issues. That was 6-7 months in advance that I wrote this up. But I had concerns, and one of my major concerns was the federal leverage of their money over our local abilities to fight that. It's real easy to put out a carrot and make people jump for that carrot, even though they've said they're not going to do that. And whether it's acquisition of property, of process, whatever it might be, our duty, mine in the past, was to look out for our local constituents and make sure that those situations weren't abused. And that's why I'm following this up. If we dot our I's and cross our T's, I'm happy, even if it's not the way I see fit. But if they're not being done that way, I want to see it changed and brought into a court. Now, our original agreement hasn't been amended, and maybe it should be. But there was some foresight in that. The reason the three of us got together was on the basis of, no, I am not going to let this authority go, being the mayor at the time. And I'm sure Dave and I talked at that time. We fully understood what we were doing, and that's in my appeal. It says that. And I don't think, I haven't changed my mind. Have you, Dave?
No, it was well written.
Yes, and that was the intent. And so I want to see this as a functioning board. I want to see it do what it has done. I'm not saying you did a bad job. I thought you did a good job. When you look at what everybody was up against, it's like the rainbows. How in the heck can you expect what they're going to do? So we jumped through the hoops. We've had disagreements on it. I just want it to be clarified. I want the process to be over. I think we need to find a date certain as to when this appeal is over. And I think most of it can functionally be done by Tom and I, and who's the county attorney now, Tom? As far as
Jed's still county attorney, but the acting was.
Right.
What's his name?
Thorngeist.
He's appointed acting.
Okay.
Acting when Jed's having treatments once a day.
Right. I knew that Jed was having
He's
problems.
traveling, but we tease him all the time. I was just with him, day before yesterday, and that, and we tell him he's a Marine. You can't hurt a Marine, especially here. He's got a brain tumor, a glioblastoma. Brain tumor, really not too bad. But he went to Cleveland, Ohio. His Amber is significant other. His brother is a doctor or some type of thing at the Cleveland Clinic in Ohio. So he went there, and it was a brain tumor, but literally it's location as far as part of the trauma. And it was here, and it was not embedded or it was operable to a point, the best you can get. And they opened him up in a big arc and got in there and did it and left it open for quite a while and did some stuff there. And he's having treatments, and he's lost some weight. He's down to his wrestling weight in high school.
And I saw him
He's
at the
amazing.
sale.
And
He looks good.
he looks good. He's back down off of steroids quite a ways, so he isn't talking 100 miles an hour, but he's an attorney. He talks about. So.
But I guess
we give him a bad time just to keep his spirits up.
But I guess my point is let's just get together and get this finished out, and then we can come back to the board at a time certain and get it resolved, and then kind of do a debrief on why we did what we did and what the repercussions were.
Yeah, and
So-
throughout this upcoming next 6, 8 months, 10 months, whatever it is, we'll watch the interim committees pretty hard, especially
Sure.
on this topic, to see, you know, like you say, some of it's reviewed and that, but it all stems back to Jed and Thorne looking at it and how they put it to words.
Sure.
So,
Well, and this is just a first step, Tom. I don't think it's gonna go any further, but I have some pretty unique abilities to go through the BS and find out what these laws say.
yeah,
And that's why I presented it the way I did. And it hasn't been argued in the contrary, and now the law has been changed
that's
to
true.
effectively say what I said. So if we can wash that out, the budget process is going right now. So we can look at those numbers, and if I think that these guys should look at it, it wouldn't be that hard to put a special together so they could look at it, review it, and start that process.
Yeah.
But that's what I would like to see, and I'd like to get it done in the next couple of months, so.
Well, we'll just have to see how Thorne's on retainer, if you will.
Sure, sure.
No,
No,
we
if he's
get
coming
him.
over and we can have an hour,
Thorne's
we can
only-
get it washed.
Thorne's
up.
here, maybe, when he's here, he's like 5, 6 hours,
Yeah,
then he's
I
gone.
understand.
You know, and then Jed's in the courtroom all the time and in on meetings and this and that. He's just required to have his rest period each day before he gets ready for the next day's radiation, which is knocking the dickens out of him a little, but it does everybody when you have it that often. So, anyway,
That's all I
next,
have.
Cindy's got down here, next meeting tentatively October 14th. I don't know what day of the week that is.
It's a Thursday.
Thursday?
Do they have to be Thursdays? Because Megan has Wednesdays and Fridays off. That's why it worked for Wednesdays, or worked on a Friday. That's why we were having
And I'm
Wednesdays.
okay through the fall on Thursdays, but then I teach
Yeah.
on Thursdays,
I
you know, at
think-
MSU.
Mr. Rice suggested having it not on Friday in the summer. So,
Fridays
October.
Fridays are a nightmare
yeah.
any time of the year. Try to get people to convene. There's this is the one and only thing I've ever had on Friday.
What about Wednesday?
Wednesdays works, but Fridays is, you can't get it's hard to get 2/3 of your people here.
Well, I'd like to be
on
able to
Friday.
take every Friday off.
Well, they don't, they go off, they're doing other things, but a meeting thing, unless it was 8 o'clock in the morning on Friday,
Can we do October 13th,
that'd be fine with me.
Wednesday?
That'd be fine, whatever, that's a long way to
I
wait.
just come to this one because it's in my town.
Yeah.
Plus the food.
Plus, I knew what Dina was gonna make. for
That's right.
So you said October 13th, is that,
That's
that's a Wednesday?
Well-
Okay.
We'll shoot for October 13th, and
Thank
the time of day, after lunch, before lunch, which is better.
Right now, my schedule is totally,
Well, we used to do it 12 to 2. That was our regular times.
Yeah.
Can we
Okay,
just keep
call
it that way?
Call it 12. Who's the host next go around?
Hospital,
Who is it?
hospital.
Okay,
Okay,
I believe you.
well, this Carol, did you catch that? She's not on the phone.
She's not on the phone.
That's why that's-
It is
that's-
hospital, yes.
Yeah, that's why she hung up. But we'll catch her. Okay, new business. One thing on that, you know, if you're looking for an agenda item, start with that review the bylaws. Maybe we could email everybody a copy that's on the board, a copy of the bylaws as they read now. And then we'll just go down through it from the top, go down through them and just go from there. Can't be that
Yeah,
remarkable.
we did that last year.
Yeah,
Yeah,
well,
we
two
did years
years
ago,
ago.
whatever it was.
2
years ago,
Two.
like I said, I can't feature a lot of changes, but
And so
the
you're
topic of
October
the-
18th of 19.
the topic of the Zoom and that type of thing, conference call people, that we're revising ours. there. I mean, it's just the sign of the times, in my opinion. I don't like it, but at least it gets the work done.
Oh,
I would like to express on that because we had that conversation earlier on that. The basic rule of thumb is the public has the right to observe and participate. It's a constitutional right. And the problem that we've had, and it was shown many times during the Zoom meetings, specifically when we had a councilman that set out for well over a year, and he zoomed into a lot of these meetings as well. And it is really hard to have a functioning meeting when people are coming in and out as he was doing. The other issue that you have is what kind of communications are they doing behind the scenes? You've got a guy on his computer with the camera on him and he's playing with his cell phone. Okay, who's your representative? Is it him or the person on the cell phone? The public has a right to know. That's why these things aren't easily taken care of with technology. If he's being coached and he's voicing someone else's opinion, the public has the right to know that. Now we being Mayor Clacken and I, had a unique experience with the Board of Regents a couple of months ago. In that meeting, I was talking to them about our vigilante field issue. Mayor Clacken had it set up on his computer at the City Hall. We were both sitting side by side. They let us speak. They never turned our camera on. They turned our microphone off when I was done speaking and the mayor didn't have the opportunity to speak. The minutes showed that we spoke. One sentence. That is not the public's right to observe or participate. It was not recorded properly. It is just asking for somebody to sue them. And these things are happening all over the state. Technology can be a very dangerous sword, and you have to be careful as to how you use it. I would suggest you're going to have board meetings, people show up. You make it to where they can show. And you only use technology when you absolutely have to, because sooner or later, somebody's going to take it to task, and I know which way it's going to fall. So, that's all I have.
Okay. Any other comments before we,
I do.
go ahead, Sue.
So during this pandemic, we talked, and maybe this is a moot point right now, about getting local ordinances in place so we could do enforcement and those kinds of things. Is that a moot thing now with the new laws, or is that something we need to pursue? I mean, I don't want to just keep talking about it, and then next time we have an emergency, we're in the same boat.
I hate to say it, I think Mayor Clacken could speak better. We probably need to wait to see how all these bills shake out, but I think it may be a moot point.
That's what I'm wondering too.
I think after the interim committee gets done with it, you know, and it's imprinted, MCA code such and such, then you can work off of those to get your ordinance process and time and petitions and public hearings and all of that above. It's not a short process to do anything.
And I envision that still could be done throughout here. That's kind of what the law is allowing now.
Although
The all three governing bodies get together, and as soon as we agree, the governing bodies do, okay, then it's really law.
Yeah, I think from what I understand, I think it couldn't be the Board of Health. It would have to be the Board of Health recommending to the governing bodies, and the governing bodies would issue the ordinance.
Correct, and then it gives it all the weight to law.
Oh, so the governing body would issue the ordinance?
Yeah, and we'd have to go through the process of public hearings.
Right, all that.
How it's written and that type of thing.
Getting it on the books.
To get it, you know, recorded as an ordinance or whatever it is. You know, so, but Charlotte's correct, you know, I mean, it's a recommendation of, you put that out there, the three bodies get together and discuss how it affects each entity. Then you go from there.
Yep.
Public hearings,
But that'll
at
only
least
work,
two.
but that'll only work if the local governing body can put something in play that's more restrictive than than at the state level, and I'm not sure right now that could happen.
I think so too.
Don't know,
Yeah.
without discussing and going through all of
Gonna
it.
take a
You might be
turn.
right, I'm not saying you're
It's
not.
gonna take an attorney.
Oh, goodness, then you get your draft,
Yeah.
and then that draft goes to public hearing, and then it gets rewritten, and, you know, and I mean, it's not a short process.
I agree with that, I just don't wanna lose that
You know,
as we.
you never know if you're gonna,
Yeah.
you won't lose it, it's just whether you can get it through.
Well, I mean, lose discussion and
Yeah.
trying to
Right.
bring it forward.
I know what you're looking at, Sue, and I think you can. I think there's abilities for the three bodies to get together and say that you as a health director or the health nurse or doctor can do certain things within the jurisdiction. The problem that you've got is there's gonna have responsibility that comes with it. So when they say, oh, you can do it, you don't want to do it unless you've got the backup documents that say, this is how we did it and why we did it, then it protects everybody. So the responsibility comes with the authority, and that's the only caveat. So you can, I think.
I'd ask for a motion to adjourn, I've never seen one of these fail.
Don't give us,
Dina, say something, will you?
Listen to him. He's always got something to say, he's a politician.
I'd like to, did you get the meeting adjourned?
I did.
I would like to say thank you for coming to Lima. We always enjoy you guys. I've worked with Sue and Mike and Wes and George and Tom for years. I know the rest of you people by faces only, I'm sorry, but you're sure welcome to Lima, and thank you for coming.
Thank you,
Thank
Dave.
you,
I
Dave.
think we had a good meeting here.
Yeah, thank you, Dina, again.
yeah, thank you.
Yeah. Thank you.
No, it's nice. The ride down's a change of pace.
Yeah.
That's for sure.